Everyone. Welcome to our webinar. My name is Kate Moore, and I'm the Manager of Programs and Services at the Brain Tumor Foundation of Canada. And I'm very happy to be here with you today for our webinar on navigating cognitive symptoms in individuals with brain tumors, what causes them and how to manage them, with Dr. Angela Sekely. We'll start with our land acknowledgement. We acknowledge that Brain Tumor Foundation of Canada is located on the traditional territory of the Anishinaabe, Haudenosaunee, Adawandran, and Wendat peoples. We honor and respect the history, languages, and culture of the diverse Indigenous people who call this territory home. We move forward with a profound sense of gratitude and respect for the land and its original caretakers, and are grateful to have the opportunity to work and live in this territory. So welcome everyone. Our webinar series is designed for anyone impacted by a brain tumor. This includes patients, survivors, caregivers, and volunteers, as well as healthcare professionals and researchers seeking to expand their knowledge. Our sessions explore a wide range of topics, including neuro-oncology, neurosurgery, research advancement, psychosocial oncology, mental health, and caregiver support. Just a few housekeeping notes before we start. So this webinar is being recorded. The recording will be available post-event on the Brain Tumor Foundation of Canada website. We have dedicated time at the end of the presentation for questions and discussion. If you would like to submit a question, please use the Q&A function to submit your question. Any resources shared during the webinar will be emailed to all registrants within a week after the event. That includes the link to the presentation. So we're going to start with some polls. These polls are going to help us understand who's here today. So we're going to put them up now. If you could fill them in, we'll get started. Okay, great. Thank you. So I'm pleased to introduce our speaker today. A little bit about our speaker. Dr. Angela Sekely is a neuropsychologist at the Pencer Brain Tumor Centre and Pediatric Aftercare program at the Princess Margaret Cancer Centre. Her clinical practice encompasses neuropsychological assessment for adults with primary brain tumors and adult survivors of pediatric cancers. Angela is involved in the clinical supervision of graduate students and research. Her research focuses on investigating the effects of cancer and its treatment on psychological, and functional outcomes and ways to help improve functioning. Welcome, Angela. I'll hand it over to you.
Thank you so much, Kate. I'm going to share my screen here, so just give me a moment to do that. And can you see this? Can everybody see this? Hopefully,
yes.
Kate. Yeah, okay, amazing. So thank you for that introduction. I'm very excited to be here and sharing some of this information about how to navigate some of these cognitive symptoms, what are they, and really to understand them better. In my role as a neuropsychologist at Princess Margaret, I really try to help patients live well in light of their brain tumor and the treatment associated with it. So really the objectives of this webinar are to identify cognitive symptoms that might be experienced by people with brain tumors, to look into some of the underlying causes of these symptoms, and to go through some strategies to support and manage these symptoms. I'd like you to please keep in mind, however, that this session is really for general education purposes only. I can't answer questions about specific patients. I'm not a medical doctor. I'm a psychologist by training. I can't provide medical advice or treatment recommendations. So for these types of concerns, please, I encourage you to speak with your healthcare team. So what are cognitive symptoms? Cognition is a huge part of our lives. It's really a lot of different types of thinking abilities. So there's many types. For one person, it might look very different than for another person. And I'm going to go through what some of those types are and what some common experiences or some common cognitive symptoms are for folks with brain tumors. But really they impact our ability to do things like take medications, to work and go to school, and they're really highly associated with quality of life. One of the most common symptoms that people report are problems paying attention. So this is trouble focusing in on a task or getting really easily distracted by things in the environment, having slower thinking speed, so feeling overwhelmed when there's too much going on, or feeling like you're having trouble following what people are saying, needing to slow down when information is presented, having trouble planning and organizing or making decisions. So trying to figure out what to do first or what a logical sequence of steps is, having a hard time planning what to eat for the week or what tasks to do or follow a recipe, for example. Memory symptoms are really commonly reported as well. So this could be forgetting the names of people that you might know really well, or having a tough time learning new people's names, being more reliant on external memory aids, so needing lists or reminders for appointments or things that you have to do during the day. Or it could be things like misplacing your keys or phone, walking into a room and forgetting why you went in there in the first place. These are all really common examples. And then, of course, problems with language. So this could include coming up with words or having trouble expressing what you're trying to say, or also understanding what someone else is saying to you. So comprehension and trying to get in information. And just really to highlight, when we think about cognition or cognitive symptoms, this is not just limited to one type of symptom. The brain is a very complicated organ, and there's many different types or domains of cognition that we think of. And I've included them here for you to take a look at. So this could be attention and concentration, something called executive functions, which are those more complex types of thinking, such as planning or organizing, remembering information, language, working with visual information, and also how quickly things are being processed. If we think about how common cognitive symptoms are quite common and distressing for many individuals with cancer generally. And our group looked at this across cancer types at Princess Margaret. And this graph here shows that when we're looking at who's reporting at least moderate to severe cognitive symptoms, the highest proportion is in folks with brain or other central nervous system cancers. And so you can see in this figure here, this is showing the proportion of people reporting moderate to severe cognitive symptoms. This dotted line here suggests that this is about 50% of those people are reporting moderate to severe symptoms. And you can see that brain and other central nervous system cancers are a little bit above that dotted line, so a little bit more than 50%. Whereas other types of cancers are a little bit less. So this is followed by breast and thyroid cancers, and then all the way through different cancer groups. And this is averaging around 25 to 40% roughly for different cancer types. So all of this to say that cognitive symptoms are common in patients themselves. They notice them, and this is something that patients are coming to providers with quite often. Now, when we look at within just brain tumors specifically, we can see that cognitive symptoms are common in all kinds of brain tumors. So this can range from things like glioblastoma or medulloblastoma, for example, but they're also common in tumors that are considered to be lower grade or even benign, in quotes. And I just wanted to highlight some of this work here. I did my PhD research looking at the cognitive effects of meningioma patients. And so this is, for those of you that don't know, meningiomas are the most common brain tumor, and they're often deemed to be benign or low grade. And I wanted to show a little example from that work. But just to highlight that there's a lot of other work looking at other specific types of brain tumors that show that cognitive symptoms are common in all types of brain tumors. And I also want to highlight that while some people have cognitive issues, other people don't report any or show any cognitive problems. So there's a large variability, and it's really important to think about how you or your loved one are really specifically impacted by the tumor that they have. So in this graph here, I just want to quickly go through this. I looked at cognitive outcomes in 61 people with meningioma who presented for a neuropsych assessment at Princess Margaret. And on average, they're about 5 years after diagnosis. In total, 68% of that sample showed cognitive impairment on standardized cognitive tests. So this isn't just what they're reporting or what they're noticing, but this is based on testing and test results compared to other people that don't have a brain tumor. And this graph here shows the cognitive results presented as something called an average Z-score. All you need to know is that 0 is average for people of that age and education. And I've shown that with the green dotted line here. And anything below this red line, below this minus 1.5 range, would be considered to be impaired on cognitive tests. And you can see that we had a really bright and intelligent sample. So the sample had a higher estimate of intellectual functions relative to the normative population, but scored lower on measures of processing speed, attention, memory, language, and executive function relative to population norms. So they are showing some cognitive impairment on standardized testing. What causes these symptoms? Of course, where the tumor is in the brain, the location of the tumor can predict what type of thinking is impacted. As I mentioned before, the brain is really complicated. It's organized in a way so that deeper parts of the brain regulate more basic functions. So if you look at, for example, the brain stem, that kind of light pink or reddish color there, that helps regulate basic functions like breathing and heart rate and digestion. And then the farther out that you move, the more complex those thinking abilities become. So if you move further away and kind of out, the last thing in the brain to develop is called the frontal lobe. And this is in charge of very complex, or what we call higher order cognitive functions. And I'll go through each of these areas with you briefly so you can have a bit of an understanding of what these parts of the brain do. So the frontal lobe is behind your forehead and kind of extends back a little bit into towards the back of your head, but it's the part of the brain that helps do things like plan and organize. If you think of, for example, what a CEO at a company or an organization does, you can think of that. Your frontal lobe is kind of like the CEO for the rest of your brain. So it helps you know what to pay attention to. It helps you know what to do first, or how to sequence things and organize what you need to do. It helps also regulate mood and control feelings. And it helps produce language as well. So much very complex types of thinking abilities. If you move down to this green area here, this is kind of by your ears to the side of your brain. This is the part of the brain that's really important for learning and remembering information, so your memory, but also for understanding what you hear, so processing auditory information as well, and for language. If we move on to the parietal lobe, so this is back behind the frontal lobe towards the top of your brain, it helps do things like understand touch and pain and figure out where your body is in space. And then just towards the very back part of the brain is called the occipital lobe. And this helps us understand or make sense of what we're seeing. So of course we see with our eyes, but that information gets sent to this back area of our brain where we process it and try and understand what we're actually seeing. And then of course the cerebellum, which is kind of this bottom part of the brain, helps with things like coordination and balance, and helps us move smoothly and stay upright as well. I want to note that although the brain is really characterized into these main functions, it's really heavily connected. So there's a lot of connections that go from one part of the brain to another. The brain really loves to talk to different parts within itself. And so if you have damage to one of those connections or one certain area, then we can try and think about what types of symptoms you might be experiencing from a cognitive standpoint. Some other important things to consider in terms of causes of cognitive symptoms are the treatment that is received. So treatments are specific to each patient, but for people with brain tumors, they often involve surgery, radiation, and chemotherapy. And these treatments help to get rid of the tumor or help the tumor stop growing, but they also might hurt healthy brain cells that are around too. So this is what can damage healthy brain cells and cause cognitive symptoms. So when we think about surgery, the goal of surgeons are to remove the tumor from the brain. So if you think about if the tumor is pressing against healthy parts of the brain or compressing it, making it much harder for those parts of the brain to work, if the tumor is taken out and that compression is relieved, then thinking abilities can actually improve. However, if the tumor is in a difficult part of the brain to access and healthy brain tissues also need to be removed to safely get the tumor out, then it can also make thinking abilities harder. Now, radiation is used if the tumor can't be removed with surgery or to stop it from growing or coming back. And radiation can damage certain types of healthy brain cells. So it can damage things called white matter tracts, which are fibers that connect different parts of the brain to one another. And also can damage blood vessels in the brain. And this can cause problems months or even years after the radiation has been delivered. And then chemotherapy helps stop the tumor from growing and can also make thinking harder. So there's a lot of research looking at chemotherapy and cognition, but it's thought to be multifactorial. There's many influences here. So damage to healthy cells, things like inflammation or hormone changes. These are all thought to relate to cognitive symptoms. A couple other factors to consider that are common in brain tumor populations, the medications that people receive. So anti-seizure medications, for example, can make it harder to pay attention or to think and process information quickly. Some other medications can make people feel tired or sad or irritable. And all of these are really important for thinking abilities. They cloud up thinking, they make it much harder to engage cognitive resources, and they're really important to keep track of. Mood is very important. So feeling sad or anxious or frustrated, of course, makes it harder to think clearly. I'm sure we can all think of a time where we were feeling really stressed or overwhelmed, and it's much harder to use our cognitive resources. So that's important to note as well. And the brain tumor itself can change how you feel or how you act, especially if it's in that part of the brain called the frontal lobe that helps regulate emotions and helps us feel motivated. So if that part of the brain is injured, then it's much harder to again use our thinking abilities. Fatigue is quite common. People with brain tumors often feel fatigued. It can be much harder when you're fatigued to focus and use your cognitive abilities when you're tired. And then, of course, brain tumors don't live in silo. There's many other health conditions that can impact cognitive abilities as well. So if you have any concerns about those things, really touching base with your healthcare team and seeing if there's other types of comorbidities that might be impacting cognition as well. When do these symptoms occur? You can see how complex or how many contributing factors there are to cognition. And so it's a tough question to answer, but you can see cognitive symptoms sometimes before the tumor is even identified. As I said, if you, for example, have a slower growing tumor that develops over time and starts to compress some of that healthy brain tissue slowly, you might start to notice some cognitive symptoms at that time that get worse as the tumor grows. But some people don't notice this until after they've received treatment. So it can be before the tumor is even identified, it can be during treatment, or as I mentioned before, it can be even several months or years after treatment that people start to notice the cognitive symptoms. Regardless of when they happen, they're often described as one of the most distressing symptoms because of their close association with functioning and quality of life as well. I also want to highlight that cognitive symptoms can occur, but not everybody has them. So that's important as well. I want to move into the part of the talk where I go through some strategies to help manage these symptoms. There's a couple of different ways to try and manage or deal with if you're noticing any of these symptoms. Of course, as a neuropsychologist, I recommend a neuropsychological assessment, but that's really challenging to find. It's not conveniently or easily offered, and it's really not feasible for a lot of folks to access. I'll tell you a little bit about what it is, just in case you want to explore if this is something that's available for you. But it's essentially an objective measure of how you're doing from a cognitive perspective. So you would do different standardized tests that measure your cognitive abilities, taken together with your symptoms and concerns and background, to better understand cognitive strengths and weaknesses, and then come up with specific strategies for to help you continue to function based on that, on your cognition. Of course, it's really limited to find. So I'll go over a couple of strategies that I typically recommend in assessments. And these are really to find new ways to compensate for specific cognitive problems, and also to help keep the brain as healthy as possible to prevent any decline in cognition. So these are lifestyle choices that do the best job that we know to keep the brain healthy overall. But I want to mention that there's no one-size-fits-all approach to managing cognitive symptoms. It's important to think about what's most distressing for you or what's most impacting you in your daily life, and try different strategies and see what works. As I mentioned, problems with attention is one of the most common symptoms that come up. So I want to go through a couple strategies to help with attention problems. If you're noticing these problems, the number one recommendation is to set up support for your attentional resources. So how can we do this? We remove distractions from your environment when you're trying to focus on something, finding a quiet place to work or talk without too much noise or mess. You can use headphones, play white noise, turn off notifications on your phone or computer when you're trying to focus in, really trying to give your brain and optimize the environment so that you have a quiet space to focus on one thing at a time. So trying not to do too much at once, avoiding multitasking. So for example, if you're trying to read something and at the same time listen to when someone is speaking to you, trying to avoid doing that. It's easier to pay attention when you're dealing with only one task or piece of information at a time. Really easy to feel overstimulated when there's a lot of things competing for your attention in your environment. So really trying to reduce that and remove some of those distractions. Use timers. So like I said, setting up structure and routine, setting a timer on your phone or on your computer for about 15 to 25 minutes, where you're really focusing on something and avoiding distractions in that time. Then factoring in a short break. So giving your brain the opportunity to rest and recover after focusing, and then going into another 15 to 25 minutes of focused work. This helps keep your attention fresh, and it's really important to rest and recharge, taking regular breaks through the day. You can take short walks, do some stretches in between, close your eyes, take a couple of deep breaths, short meditation. All those things are really helpful to help focus in your attention. And then also noticing patterns. So keeping a journal or a book to see when you're feeling the most alert and focused during the day. It could be for some of us in the morning, it could be in the evening for others, but trying to schedule important tasks during times where your attention is really at its best. A couple of strategies to help with memory. So if you're noticing that it's harder for you to learn and retain information, here's a few things that might be helpful. The first thing to think of is that in order to remember information, you first have to pay attention to it. So attention is a precursor to your memory. So the first thing that you need to do is focus in your attention when you want to remember it. And one strategy to use is called stop, see it, say it. I use this strategy all the time in my own life. But the first step is stopping yourself, actively turning on your attention resources. So it might feel effortful to do this, but focusing and effortfully turning on your attention. So let's say, for example, if you keep misplacing your keys or your wallet in your apartment, you first stop, you put your attention resources together and focus on what you're doing. You're putting your keys or your wallet on the table. You see yourself actually doing it, putting your keys or wallet down, and then you say it out loud to yourself, I'm putting my keys or wallet here. So it's things that you're actively doing, or something you want to remember to do in the future. Say you want to call a family member at the end of the day, you stop, you focus in your attention, you visualize yourself calling your family member at 5 p.m. and you say it out loud to yourself, I'm going to call my family member. And by doing that, you're really focusing in your attention. You're using different senses and resources and engaging more of your brain, so you're more likely to remember it later. Make information meaningful. So relating new information to things that you already know makes it easier to remember that information later on. For example, if you're meeting a new person, think about someone you already know with a similar or different appearance or name, personality or interests. The more deep the association you make, the more able you're going to be to remember that information later on. Of course, write things down. So recording information in an organized way. The action of just recording something helps us to remember it later. So use a notebook or your phone to keep track of schedules and tasks and things to do. And the main recommendation here is to use one portable system to organize everything. So don't use a million sticky notes all over your desk, which admittedly I have around me right now, but use one notebook or keep it all on your phone, keep it together and take that thing with you. So take the notebook, keep it on you, or keep your phone with you all the time. That way, if you have to add something to it when you're out and about, then you can do it right there in the moment instead of having to rely on your memory to do that, to add it to your calendar or notebook when you get home, because that just adds a whole extra layer and you're more likely to forget to do it. A couple of nice features to have in your phone or notebook include a calendar, so for appointments and scheduling things, a to-do list, so items that need to be completed throughout the day that you can check off or cross off, and a section for permanent information as well. So information that's useful to store safely, but that's difficult to remember. So things like a list of passwords, phone numbers for doctors, things like that. Of course, set reminders for yourself. Use alarms on your phone or on a lot of smartwatches are around now. So use that to remind you when it's time to do something. And prepare for things in advance. So for example, if you have an upcoming appointment, these are often stressful, write down questions for your medical team, bring them with you to your appointments, bring your portable organizer with you so you can write down any important information being given to you. And you can always ask your provider to slow down or pause if you need more time to make a note. With memory, it's really easy to get stressed and overwhelmed when you forget something. It's important to try not to dwell on these things. If you become more upset or you have more stress because of this, it's going to be even harder for you to remember information later on. So really trying to regulate and manage stress in the moment. If you remember that information later, then write it down in your planner later on. A couple of strategies to help with word finding or language problems. Talking around the word can be really helpful. So instead of focusing on recalling a specific word or name, or getting stressed because you can't recall that word, talk around it. Use other words to describe what you mean. And this approach reduces your stress levels and makes it easier for that word or name to come back to you. Use the alphabet, so try and think of what the first letter of the word is. Scan through the alphabet to see if any letter prompts your memory of the word. And again, you're really just trying to prompt yourself and prompt your brain to try and find that word in different ways. Use physical action. So sometimes acting things out with your hands, acting out the words with your hands or body parts can help in recalling it, or can help the person that you're trying to talk to guess the word that you're thinking of. And then, of course, things like speech language therapy exist. So if there's really a lot of problems expressing yourself or understanding, this might be a good avenue to explore. One symptom that's really quite common that I see often is having low motivation on tasks, or struggling with initiative and being able to start going on tasks. So to target this, really breaking things down into very simple steps that don't seem overwhelming makes it much more likely that you're going to get started on it. If you break it up and you say, I'm going to do this little piece just to get started today, it's going to be much less overwhelming than doing the whole thing, having to sit down and do the whole thing at once. Using something called the 5-minute rule. So if you're struggling with initiating on a task or having low motivation to get started, set a timer for 5 minutes. Just get started on the task without thinking about it, and tell yourself, I only have to work on this for 5 minutes. See how you're feeling when the timer goes off. See if you want to continue, or if you want to stop and put it aside for later, or you could write it down in your organizer. But really, it's often that initial step or those first couple minutes of getting started that are the hardest. So convincing yourself to just get through those first 5 minutes, you're going to feel more likely that you'll want to continue if you get through those first couple of minutes. Creating a regular schedule. So routine is so important. A regular schedule with sleep, but also tasks during the day, and your body will kind of get used to being in a certain rhythm. Have an accountability partner. This always helps. So if you're trying to sit down and do focused work, maybe getting a buddy to join and set timers with you, and having someone there to help get you through that initial stage of low motivation. And then also connecting tasks with value goals. So things that you enjoy doing. If you're doing something that you don't like doing, pair it together with something that you do like doing, so that you could start associating that task with something that you like. These are all really helpful if this is something that you're noticing. So cognitive strategies, are trying to work around some of these things, are one way of managing these cognitive symptoms. But another way to try and protect against cognitive decline, or any changes in cognition, or maintaining a brain healthy lifestyle. So what does this mean? This is managing mood, exercise, diet, sleep, and continuing to be engaged. For managing mood, it's really normal to feel stressed or upset or frustrated when you forget something, or you can't think of a word, or you can't complete a task like you maybe were able to do before the brain tumor. But the added stress or the added low mood makes it even harder to use your thinking abilities. So things like mindfulness and meditation practices can help to manage mood and stress in the moment. So these are often, there's so many online free resources that you can use to help manage those things on the fly while you're actually experiencing them and doing things. But if you're really struggling with a lot of anxiety or low mood, your mood or anxiety are heightened all of the time, and it's impacting your ability to function, it's important to tell your healthcare team, and they might suggest that you see a mental health professional like a social worker or psychologist or psychiatrist to help with that. In terms of physical exercise, regular physical exercise helps protect brain functions, but it also hits on a lot of those other causal factors that I mentioned earlier. So it helps to reduce fatigue, it relieves stress and improves mood. Here, there's not one prescription or activity that you can do that really optimizes brain health in general. It's more about choosing activities that you enjoy, that you can stick with, that make you feel good, because you're going to be more likely to keep them up over time. And it's also important to make sure you're taking breaks in between activities and finding an optimal balance that feels right for you. Even just going out for a short walk or doing some stretches in your chair is better than nothing. And so trying to find times where you're able to do that. Maybe you incorporate it in your usual routine. Any routine is really good, as I've mentioned. But really important, if you can, to try and prioritize physical exercise. Maintaining a healthy diet is also important for brain health. Some of the treatments I mentioned earlier can impact appetite, like radiation and chemo, for example. Here, it's important to keep nutritious and balanced meals. There's no single food that has been shown to have all the nutrients you need to support cognition, but really trying to eat a variety of nutrient-rich foods, drink plenty of liquids, and avoid alcohol and other recreational substances because they can also impact thinking abilities in a negative way. Managing fatigue and sleep also, as I mentioned, fatigue makes it hard to focus and remember and learn information. So spreading activities through the day, taking rests. If you have a day where you're doing a lot of things, you're probably going to feel really tired the next day. So maybe pairing a less demanding day after a more demanding day, and really trying to notice again when you're feeling tired or when you're having trouble sleeping. You're probably going to notice that the cognitive symptoms get worse or feel tougher. So trying your best to create a balance that works for you, and spread things out and give yourself rest. And then, of course, sleep is important for brain health and can impact attention and memory also. So avoid caffeine late in the day, create a calm bedtime routine that helps you wind down, and avoid using electronic devices as well too, that are close to bedtime. And then the last point I have here is cognitive and social engagement. So remaining engaged in cognitive and social activities, participating in hobbies like puzzles or reading, arts and crafts, really anything. Your brain is like a muscle, so using that muscle, continuing to use that muscle, finding things that you enjoy is really important. Some people, because of their cognitive issues, tend to be more isolated and not enjoy socializing as much. But social engagement is really important for brain health and can improve mood and is a protective factor against cognitive decline. So if it's possible, continuing to engage in these activities is important. Now, if you're a caregiver or a family member of someone, or a friend of someone that has cognitive symptoms, it's really important to remember that the person with the brain tumor is not doing these things on purpose, right? If you're, for example, if you're talking to them and there's a lot of other noises going on at once in the room, it might be much harder for their brain to process both things coming in at once. And just because someone looks like they might have recovered from the impact of the tumor, so they're scar has healed or they look like they're starting to have more energy. These symptoms might still be there. And so that's really important to try and understand. But a couple of, in light of that, a couple of recommendations to help support someone. Again, it's breaking things down into smaller, more manageable steps, encouraging some of these strategies that I've talked about already. So encouraging someone that has a memory problem to use to-do lists and write things down and use a day planner, and reminding them to bring it with them when they leave the home. Suggesting that they do tasks at times of the day where they feel their best, incorporating breaks, and providing as much structure and routine as you possibly can help them just get into a new flow of things and see what the new normal is. And then really important to note, to be patient with yourself and to monitor for something called caregiver burnout. So for those of you who haven't heard this term before, caregiver burnout is a state of physical and emotional and mental exhaustion that is quite common in caregivers of any type of medical illness. But when caregivers take on too much responsibility for another person's care or functioning, then they might start neglecting their own needs. And this could look like elevated stress and anxiety, or fatigue, or feelings of withdrawal or low mood in the caregiver themselves. So monitoring for some of these effects as well is really crucial. There's a lot of literature to suggest that caregivers themselves often neglect their own medical needs and have a higher risk of things like low mood and physical conditions as well as a result of this. So it's really important. I'm just wrapping up here. I have no idea what time it is. Hopefully I'm still on time. But just to highlight all of the amazing work being done at the Brain Tumor Foundation of Canada. I love that there's these webinars that help with education, and they have a lot of handbooks and other resources that are available on their website. Support groups, they support a lot of research initiatives. And through one of those research initiatives, I'm developing a resource to really help patients and caregivers understand some of these cognitive changes better and get better access to some of this information. So those are coming soon. I just want to put a little plug in there for everybody, that there's more resources that we're hoping to develop over time. Thank you for joining. I really appreciate everyone's attendance and time today, and happy to answer any questions or any comments.
Thank you so much, Angela. That was a great presentation. I know I'm going to use stop, see it, say it to try to find, to remember
one of my
where I put my
favorites,
keys.
yeah.
We do have a couple of questions. So let me just look through here. Are there therapies or treatments to help mitigate the cognitive effects caused by radiation?
This is a good question. So there's something called cognitive rehabilitation, and this is these are treatments that are really based largely on what I presented today. So it's not about necessarily rehabbing a specific part of the brain. It's more about learning what some of those symptoms are and trying to use other parts of the brain or other strengths to get around some of those weaknesses. So there's treatment like that, and there's a lot of different strategies that can be learned to kind of bypass or help manage with some of the symptoms that are coming up. But other than that, it's really about promoting a brain healthy lifestyle, as I suggested. So not everybody develops these symptoms over time. So if you had radiation, it's possible that months or years later you can notice cognitive symptoms, but not everybody notices them. So giving your brain the best chance at recovery, giving yourself the focusing on some of these protective factors that we know about the brain and how it functions is really the most important piece.
Perfect. And then somebody else asked, can your cognitive functions get better or are they just managed?
Yeah, it depends. It depends on what's causing them. As you can see, there's a lot of different factors that can contribute to cognitive symptoms. Usually with treatment, or for example, with surgery, if you're noticing any cognitive changes just shortly right after the surgery, a lot of recovery, the most amount of recovery happens in that first 3 months to 1 year, as your brain is kind of trying to get regulate and heal itself. But you know, often people don't return to what their own baseline is. So you might still experience, even though there's some improvement, you might still feel like it's not quite what you're used to.
And the last question I'll ask here that's a little more general. What does a neuropsychological assessment look like and how is it accessed? Like, can you access it online, or is it done in person?
This is a tough question. There's
Mhm.
not, it's not routinely incorporated into hospital settings, so it's tough to find. What it involves is basically a full day appointment with a neuropsychologist. So that includes, you know, something called a clinical interview where you'll have questions about your background and the symptoms that you're noticing. They'll review your medical history, ask about mood and other potential contributing factors to cognition, and then do standardized testing. So this is different kind of paper pencil tasks that have all been done by similar people of similar ages and education levels. And you can see how you're doing relative to other people that don't have any medical history and see if there's any areas of cognitive weakness. And then if there are, there's very specific recommendations directed to those areas of cognitive weaknesses that you can talk about and learn more about and when you talk about the results of the assessment. So specific strategies, you can get things for accommodations for school and work and things like that, and how to best keep functioning independently.
Okay, great. Thank you so much.
So, thank you. It's been such a pleasure to be here, and I love all of these webinars that the BTFC offers. And thank you to everyone for listening and for your time. It's been such a pleasure.